There's a decision most people make at 65, usually within a few weeks of their Medicare start date, that they assume they can revisit whenever they want. I watched people carry that assumption for years. And then, somewhere around 72 or 75, when their health had changed and their plan no longer fit, they discovered that revisiting it was not nearly as simple as they had believed. That gap between what people assume and what the rules actually allow is what this video is about. If you're in Medicare Advantage right now, or if someone in your household is, you are sitting inside a window that closes on March 31st. And what you do before that date, or what you decide not to do, matters more than most people realize. By the time this video ends, you are going to understand exactly what this January through March window allows you to change, what it does not allow, and the one protection that exists for people in their first year of Medicare Advantage that quietly disappears after 12 months. I am also going to walk you through why your costs may have jumped in January, how to appeal a Medicare premium increase if your income has dropped, and what to watch for if you are turning 65 soon and want to get this right before the calendar becomes your enemy. Stay with me through the Medigap underwriting section especially. That is the part most people wish someone had explained to them earlier. Who this March 31st deadline applies to. Here is something that surprises people every year, even people who have been on Medicare for a decade. If you are enrolled in a Medicare Advantage plan as of January 1st, whether this is your first year or your 10th, you have a one-time opportunity each year to make a change to your coverage. That window runs from January 1st through March 31st. It's called the Medicare Advantage Open Enrollment Period, and it applies to you specifically if Medicare Advantage is where you are enrolled right now. This is not the big fall enrollment window. This is smaller, quieter, and more limited. Most people don't even know it exists until they're already inside it, and sometimes not until after it has closed. Here is what this window allows you to do. You can switch from your current Medicare Advantage plan to a different Medicare Advantage plan. You can do that once. Or you can leave Medicare Advantage entirely and return to original Medicare. If you return to original Medicare, you can also add a standalone Part D drug plan at that time. One change. That is the rule. And it resets every year. So if you made a change last January and did nothing the year before, you still get this opportunity again right now. The one change limit applies within each January through March window, not across your lifetime. But here's where people get tripped up, and this is the part I want you to hold on to through the rest of this video. The question is not only what the rules technically allow, the question is what you are actually eligible for given your health. Because that distinction between what is allowed and what is available to you specifically is what the rest of this conversation is really about. What you cannot do during this window. Now here's the part that catches people off guard, because they assume this window opens more doors than it actually does. You cannot switch from original Medicare into a Medicare Advantage plan during this window. That direction, from original Medicare toward Medicare Advantage, does not work here. You cannot make multiple changes. If you switch from one Medicare Advantage plan to another, that's your one move. You cannot also drop Part D, add coverage, or change again. You cannot add or drop a Part D drug plan unless you are leaving Medicare Advantage entirely. And you cannot automatically enroll in a Medigap supplemental policy without going through medical underwriting unless a specific protection applies to your situation, which we're going to cover in a moment. Once March 31st passes, most people cannot make any changes until October 15th. That's the next open window. And between now and then, the only way to make a change is if you experience what Medicare calls a special enrollment period, a specific life event that qualifies you for an exception outside the normal calendar. We'll get to those exceptions, but I want you to understand first, March 31st is a real deadline, and the flexibility you have right now is more than you'll have on April 1st. Why your costs may have jumped in January. Before we go further, I want to address something that is sending a lot of people to this video right now. January arrives, and suddenly things feel different. Your prescription moved to a higher drug tier and costs more than it did in December. Your specialist now requires prior authorization. Your deductible resets, and an early appointment felt expensive in a way it did not feel last fall. And the question that follows, almost always, is this: did I choose the wrong plan? Here is what I want you to separate before you do anything else. Every January 1st is a reset for Medicare. Your Part A deductible, which covers hospital care, resets. Your Part B deductible, which covers medical visits and outpatient care, resets. If you are in Medicare Advantage, your out-of-pocket maximum resets, and your Part D drug deductible resets. Prescription drug tiers can also change, meaning a medication that was Tier 2 last year may now be Tier 3 at a higher cost to you, even if you are in the exact same plan. This happens every single year. It is not a signal that something went wrong. It is the annual mechanics of how Medicare is structured. So the question to ask before making any move is this: is what you are experiencing a normal annual reset, or is it a genuine mismatch between your health needs and the plan you are currently in? A reset is uncomfortable, but expected. A mismatch is a real problem that this window is designed to help you address. Ask yourself honestly, are my doctors still in network and actively participating in my plan? Are my prescriptions still covered, and at what tier? Has something changed in my health, a new diagnosis, a new specialist, a new medication that makes my current plan genuinely unsuitable? Or did my deductible simply reset on January 1st, the way they do every year? That distinction matters, because if you make a plan change based on a normal reset, you may find yourself in a new network with new rules, having traded one set of predictable costs for a set of unknown ones. The Medigap underwriting issue that surprises people every year. This is the section I want you to pay the most attention to. Most people assume that if they want to leave Medicare Advantage and move to original Medicare with a supplement plan, sometimes called Medigap, they can simply make that choice whenever they are ready. The rules allow it. The window exists. What could stop them? What stops them is their health. In most states, if you want to purchase a Medigap policy outside of a guarantee issue window, the insurance company has the right to ask you health questions, review your medical history, and make a decision based on what they find. They can charge you a higher premium. They can exclude coverage for certain conditions. In some cases, they can decline to cover you at all. This is medical underwriting, and it applies to most people in most states who try to leave Medicare Advantage after their initial enrollment period has passed. So the scenario plays out like this. Someone enrolled in Medicare Advantage at 65 when they were healthy, the premiums were lower, and the plan seemed to cover everything they needed. A few years later, they develop a chronic condition. Suddenly, the prior authorization requirements feel different. The specialist network feels narrow. They decide they want the broader access that comes with original Medicare and a Medigap supplement. And then they find out that in their state, getting a Medigap policy now with their current health history is either significantly more expensive or not available to them at all. This is not a rare situation. It is one of the most common things I saw in 25 years of working with real clients. And the people it surprises most are the ones who assumed they could always change their mind later. Think about where you are right now. If you are 65 or 66 and in your first year of Medicare Advantage, you have a protection available to you that will not exist next year. If you are older and your health has changed, the question of whether you can get Medigap coverage is not just a calendar question, it is a health question. The trial right and why it matters if you are in your first year of Medicare Advantage. Here is the one protection that exists specifically for people in their first year of Medicare Advantage, and it is one of the most underused protections in all of Medicare. If you joined Medicare Advantage when you were first eligible for Medicare, generally at age 65, and you are still within the first 12 months of that plan, you have what is called a trial right. This gives you the ability to return to original Medicare and purchase certain Medigap plans with guaranteed issue, meaning no health questions, no underwriting, and no possibility of denial. You cannot be turned down. Your health history does not matter. The insurance company is required to offer you coverage. This protection was designed exactly for the situation I described a moment ago. It gives you 1 year to experience Medicare Advantage and decide if it is right for you without permanently closing the door to Medigap. Once that 12-month window closes, the guaranteed issue protection from the trial right goes away. Some states have additional protections. A handful of states require guaranteed issue rights for Medigap in broader circumstances. It is worth knowing whether your state is one of them. But in most states, for most people, the trial right is a one-time window. If you enrolled in Medicare Advantage at 65, and you are now 65 or 66 and still in that first plan, this is worth understanding carefully because the flexibility you have today is not the flexibility you will have at 70 or 75. Carolyn's story. I want to tell you about someone I worked with, not to illustrate a rule, but because her situation is one I think a lot of people will recognize. Carolyn was 66, a retired school librarian from Akron, Ohio. She had spent 31 years working in the same district, and she retired with a small pension paying around $740 a month. She had about $210,000 in a 403B, and her husband Ray had a modest Social Security benefit. Together, they were careful, deliberate people who read everything before they signed it. When Carolyn turned 65, she enrolled in a Medicare Advantage plan. The premium was low, nearly zero, and the plan covered her primary care doctor and the 2 prescriptions she was on at the time. It seemed like a sensible choice. By 66, Carolyn had been diagnosed with a condition that required her to see a rheumatologist regularly. The specialist she wanted was not in her plan's network. Getting to one who was required a referral, then a prior authorization, then a second review. The process took weeks and felt, in her words, like asking permission for her own health care. She came to me wanting to know if she could switch to original Medicare with a Medigap supplement. She had assumed she could. The question she was too afraid to ask out loud, the one she had been carrying for weeks before she called, was whether she had already made a mistake she could not undo. Here is what we found. Carolyn was past her 12-month trial right window. In Ohio, Medigap plans are subject to medical underwriting outside of guaranteed issue situations. With her new diagnosis on record, the underwriting process was going to be complicated, potentially resulting in a higher premium or exclusions for the exact condition she needed covered most. She was not locked out entirely, but the path that had been wide open at 65 had narrowed considerably at 66. What Carolyn did was stay in Medicare Advantage, but use this January through March window to switch to a plan with a broader specialist network and fewer prior authorization requirements for her condition. It was not the same as the open access she had wanted, but it was meaningfully better than what she had. The thing she said afterward, quietly, without any drama, was that she wished someone had explained the underwriting part before she made her first choice. Not to frighten her, just so she could have decided with the full picture in front of her. That is what this video is trying to do for you. Special enrollment periods, when life does not follow the calendar. Medicare knows that life does not always cooperate with enrollment windows. That's why certain life events trigger what is called a special enrollment period, the ability to make a change outside of the standard January through March or October through December windows. These situations are specific. Moving out of your plan's service area qualifies because Medicare Advantage plans are built around local networks, and if you relocate outside that network region, you may no longer have meaningful access to in-network providers. Losing employer-sponsored coverage qualifies, which typically applies if you or a spouse continued working past 65 and had coverage through an employer that has now ended. If your current Medicare Advantage plan is discontinued or leaves your area, that qualifies. Gaining or losing Medicaid eligibility qualifies, as does gaining or losing the low-income subsidy for prescription drug coverage. These are not common situations, but they are important to know. Because if March 31st passes and your circumstances change in a qualifying way, you are not necessarily locked in until October. You may have an exception available to you. If you're not sure whether your situation qualifies for a special enrollment period, the Medicare helpline at 1-800-MEDICARE is the right place to ask. The answer matters. Why your premium may have jumped and how to appeal it. Here is something worth pausing on because it affects more people than realize it. If your Medicare Part B premium increased noticeably at the start of this year and you retired in the last 2 years or experienced a significant drop in income through divorce, the death of a spouse, or a reduction in work hours, you may be paying a higher premium than your current income actually warrants. And you may be able to appeal it. The adjustment is called IRMA, the Income-Related Monthly Adjustment Amount. It is the additional amount higher-income Medicare beneficiaries pay on top of the standard Part B premium. The way it works is that this year's premium is based on your income from 2 years ago. So, if you earned significantly more 2 years ago than you do today, you may be subject to an IRMA surcharge that no longer reflects your actual financial situation. Medicare allows you to appeal that determination if your income has dropped due to what they classify as a life-changing event. Retirement qualifies, divorce qualifies, the death of a spouse qualifies, a significant reduction in work hours qualifies. What does not qualify, and this is important, is a Roth conversion. If you converted a traditional IRA to a Roth 2 years ago, and that conversion pushed your income above the IRMA threshold, Medicare does not consider that a life-changing event eligible for appeal. That is one of the reasons Roth conversion timing requires careful attention to these income thresholds. If you believe your IRMA determination does not reflect your current income, the appeal is made using SSA Form 44. The Social Security Administration reviews it. And for people whose income has genuinely dropped, this is money that belongs to them, not a favor from the system, but a correction the system is designed to make. Most people either do not know they can appeal or assume that once the determination is made, it is fixed for the year. It is not. It is worth the phone call. If you are turning 65 soon, this part is for you. If you are turning 65 in April, May, June, or July of this year, you are probably doing exactly what you should be doing right now, researching before the deadline arrives. Your enrollment window is called the initial enrollment period. It runs for 7 months, 3 months before your birth month itself, and 3 months after. The timing of when you enroll within that window affects when your coverage begins, so earlier in the window is generally better. Enrolling late, outside that 7-month window, without a qualifying exception, can trigger permanent premium penalties on Part B and Part D. Those penalties do not go away. They follow you for as long as you have Medicare coverage. But here's the part that matters most for this conversation. When you first enroll in Medicare, you have more flexibility than you will have at any other point in your Medicare life. You can choose Original Medicare with a Medigap supplement, and in most states, because it's your initial enrollment, you have guaranteed issue rights. No underwriting, no health questions, you cannot be denied. Or you can choose Medicare Advantage. Both paths are available to you. Both have real advantages and real trade-offs. The question is not which path is better in general. The question is which path fits your health, your priorities, and how you want to access care over the next decade or two. Because the decision you make at 65, when you're likely healthy, when both doors are open, shapes what is possible at 75 and at 85. January 1st is the annual reset for everyone. Deductibles restart, drug tiers can shift, new plan benefits take effect. If something felt different this January, that's why. January 1st through March 31st is specifically for people enrolled in Medicare Advantage. One change permitted during this window. This is the window we've been discussing. March 31st is the cutoff. After that date, most people cannot make changes until fall unless a qualifying life event opens a special enrollment period. April through June matters if you're turning 65 in the spring. That's when your initial enrollment period begins. October 15th through December 7th is the annual enrollment period, the large fall window when anyone on Medicare can make changes that take effect January 1st of the following year. When you see it laid out this way, Medicare becomes less of a mystery and more of a calendar. The rules haven't changed, you've just learned where the windows are. How to evaluate your situation before March 31st. Here is how to actually use this window, not just understand it. Start by auditing your current coverage honestly. Are your primary care doctor and your key specialists still in network and actively participating in your plan? Pull up your plan's provider directory and verify, because doctors who were listed last year may have left the network, and a directory from last fall may not reflect the current list. Are your prescriptions still covered? Are they at the same tier as last year, or have they moved to a more expensive tier? Is the issue you are experiencing a January reset, a predictable annual adjustment that happens in every plan, or is it a structural mismatch between your health needs and what your plan actually provides? If it is a reset, that is normal. It is not a reason to change plans. If it is a mismatch, if your plan genuinely no longer fits your health situation, your providers, or how you need to access care, then this window exists for exactly that reason. If you are considering switching from one Medicare Advantage plan to another, do not guess. Before you make that change, verify that your key doctors and hospitals are in network on the new plan. Confirm that your prescriptions are covered and at what tier. Ask specifically about prior authorization requirements for any imaging, therapy, or procedures you are expecting this year. Understand the referral rules. Switching plans means switching networks. Make sure the trade is in your favor before you make it. If you are considering leaving Medicare Advantage for Original Medicare and a Medigap supplement, this is a separate conversation that depends heavily on your health status, your state's rules, and whether any guaranteed issue protections apply to your situation. That path may be fully available to you, partially available, or significantly complicated, and knowing which is true for you specifically requires understanding the underwriting rules we covered earlier. If you are turning 65 soon, your task right now is research. Use the time before your initial enrollment period to understand both paths fully. The flexibility you have at your initial enrollment is the most flexibility you will ever have. Use it with intention. What this is really about. Here's what I want you to take away from this video before we close. Medicare is a system built around timing. The calendar is not arbitrary. It reflects real enrollment logic and real financial consequences. And once you understand where the windows are and what each one allows, the system becomes something you can navigate rather than something that happens to you. The January through March window is not just a technical enrollment period. It's a recalibration moment, a chance to ask whether the plan you have today still fits the life you are living, not the life you had when you chose it. For most people, the answer will be, the plan is fine, the January costs are just the annual reset, and no change is needed. That is a valid conclusion. A thoughtful no is just as valuable as a thoughtful yes. For some people, the answer will be different. The network has changed, a diagnosis has changed, a provider relationship has changed, and this window is the structured opportunity to respond to that before March 31st with one clear, intentional change. And for a smaller group, especially people in their first 12 months of Medicare Advantage, this is the moment to understand what the trial right means for your specific situation, because the door that is open today may not be open next year, not because the rules changed, because your health did. The decision you make at 65 when you're healthy and both paths are available can echo for 20 or 30 years. That's not meant to frighten you. It's meant to give you the weight of this moment, so that whatever you decide it fully with your eyes open. Conclusion. Before you close this video, I want to ask you to do one thing. Write down the names of the 3 doctors or specialists you see most regularly, your primary care physician and the 2 specialists that matter most to your health right now. Then, go to your plan's provider directory and verify that all 3 are listed as in-network and actively participating. Not just listed, actively participating. It takes 10 minutes, and it will tell you more about whether your current plan is actually working for you than anything else you could do today. If something in this video helped clarify something you've been carrying around about your plan, about your options, or about a decision you made at 65 that you've been quietly second-guessing, leave it in the comments. I read everyone, and more often than not, the question you're sitting with is the same question someone else watching this video is sitting with too. If you know someone who's sorting through Medicare decisions right now, send this to them. This kind of clarity is easier when you're not working through it alone. I'll see you in the next one.